Okay then, two lifestyle sins that could be causing your tinnitus, and don't blame the dentist, and you'll find out what I mean by that in just a second. Now, tinnitus can be site specific. In other words, it is caused by certain site problems in your body, and it can be easier to treat. For example, if you have tinnitus and you usually grind your teeth, then it is most likely that you have TMJ caused tinnitus. Now, this can easily be solved by addressing your TMJ problem. Here are a couple of examples extracted from the book Diminish Tinnitus that could be causing your tinnitus. Head problems. TMJ syndrome. Now, TMJ syndrome is a medical condition with overlapping disciplines, meaning different medical practitioners from different fields may have different opinions on TMJ syndrome and may prescribe different courses of action to take. Now, try to check your tinnitus, see if there are other symptoms that go along with it, like facial pain, especially with your jaw area, pain in the jaws, clicking or popping of the jaws, teeth grinding, or swelling. Now, if your tinnitus is accompanied by any of these symptoms, then it is highly recommended that you see your dentist. There is a huge possibility that TMJ syndrome, that's what it is that's causing these tinnitus symptoms. Now, your dentist will be able to help you correct any behaviours as well as your bite pattern which causes TMJ syndrome. Surgery can also help stop it, but it is quite rare nowadays as there are better methods that your dentist can use without having to resort to surgery. Here are some specific behaviours connected to TMJ syndrome which you could stop. Nail biting and gum chewing. If TMJ syndrome is causing your tinnitus, then curing the TMJ syndrome will severely reduce or in fact completely cure your tinnitus symptoms. Now, if you still have other symptoms left, then the rest of the Diminish Tinnitus book talks about other aspects which will help get rid of your tinnitus. Now, tinnitus or not, TMJ syndrome should immediately be addressed anyway. Now, another head problem, head and neck tension/injuries. Now, if you have tinnitus, try to check your lifestyle on the things you do regularly. Do you work for long periods where your neck is severely under uneven loads or stress? If this is so, there is a very high probability that your tinnitus is caused by this. One common example for this situation is by holding the telephone between your face and shoulder for extended periods of time. This is extremely bad for you, and if you have to do this so often, ask for a headset. Now, this is most important because holding the phone using your head and shoulders does not only cause tinnitus, but also causes a whole range of neck injuries like cervical spondylosis or nerve pain twinges. Now, if you have suspicions of neck injury or asymmetry, then you should see a professional about this before things get worse. An osteopath is someone who specialises in the musculoskeletal system, and he will examine you and ask you to get necessary scans. Now, depending on the result, he will then provide a treatment plan for you, probably physiotherapy. Do remember, however, that if you only have neck injury without any asymmetry present, then an osteopath will not be able to help you since there is no underlying skeletal or muscular abnormalities. But getting regular shoulder and neck massages can do great for your neck tension, but you have to get the underlying cause of it, which is most probably stress and tension. Now, to find out the other site-specific causes of tinnitus and exactly what to do about them, then please go to diminishtinnitus.com and find out how to cure your tinnitus naturally and permanently.